Thank you all for joining us this evening and this afternoon. My name is Evie and I am the Board Chair of Children and Young People with Disability Australia, and I will be facilitating the event today. I would like to acknowledge the traditional custodians of the lands from which we are all joining today and in which we're connecting over. For me, that is the Ngunnawal and Ngambri people. I extend this acknowledgement to the custodians of the lands from which you are all joining from. I pay my respects to elders past and present and recognise their continuing connection and contribution to this land. And I'd really like to extend this respect to First Nations people who are joining us today. I acknowledge that we are all calling from stolen land and that sovereignty was never ceded. This always was and always will be First Nations land. So thank you so much for joining us today. A little bit of housekeeping before we kick off the main session. We are in a webinar format today. There is no chat function available in the session, but we will be asking for your feedback and thoughts in a survey after the event. You will get that link in the chat. It will also pop up after you leave the event, and then you will also get it in an email later. Today, we're going to be hearing from a series of speakers from our sector talking about the experiences of NDIS reassessment and eligibility assessments. And I'll also give you a little bit of detail about the results of our recent survey that we hosted over this topic. We are recording this webinar and it will be available together with the slides on our website and on our YouTube channel. We have live captioning available by Melinda from Expressions Interpreting, and you can access that either in your browser at the link provided by the chat, or you can enable captions in Zoom by going to More in your Zoom toolbar and then selecting, looking a bit different on my screen today, but turn on live captions or show captions depending on your version of Zoom. You may also just have the CC button sitting in your Zoom toolbar that you can click. And if you are having any issues with that, please do email the team. You can change your view of the webinar with the view button in the top of your Zoom interface to show different speaker and presentation views, or just show the current speaker, but the current person speaking and an interpreter will always be spotlighted. If you require multi-pin access, so if you want to pin additional speakers, or if you want to have both interpreters pinned at all times, please email Maddie, who is doing our tech support today, and Maddie will put that email address in the chat. You can also contact our Safety and Wellbeing Officer, Liz, and Liz's details will be placed in the chat just in case you need to access those as well. If you do need support beyond the webinar, you will be able to contact some of the support services and we will link those into the chat as well. So we're having this webinar to do something practical and helpful for our community. We've heard from our members that our members are experiencing NDIS eligibility reassessments, and we've heard overwhelmingly that there is confusion, that there is more information needed in this space, and most importantly, that coming together as a community is really important to discuss how this is impacting us, particularly children and young people with disability. So an eligibility reassessment is a check to make sure that NDIS participants still meet the requirements to receive NDIS funding. And in late 2024, the NDIA started conducting significant numbers of reassessments. Over 1,200 reassessments are being conducted weekly. So we're hearing that 48% are being removed from the NDIS as a result of their reassessments, and 80% of those receiving those reassessment letters are children aged 5 to 9. Participants originally had 28 days to respond to those reassessments with additional evidence, but this has since been extended to 90 days. In our survey that we conducted in May 2025, we heard from our disability community that you feel worried, scared, and confused about reassessments. We wanted to provide practical and proactive support and the information that you need to self-advocate about reassessments. We are going to put the link in the chat to our survey report. And I'm going to give you just a little bit of an overview of some of the findings that we had through the survey. Next slide, please. I've got a slightly different order in my run sheet, but that's okay. We heard from 222 people to our survey over the 10 days that it was open. We heard from a range of different people and different relationships with the NDIS. 71% of people who responded were parents and caregivers of predominantly people who care for children and young people who are NDIS participants. We also heard from a range of different disability and impairment experiences throughout the survey, and you can read that in full on our website. Next slide, thank you. So I won't go through all of these numbers and all of these statistics because it might be more valuable for you to go through those in your own time and be able to process those as you need to. But broadly speaking, we collected some information about the timing in which people receive their reassessment letter and some of the characteristics of people who are receiving these letters. Quite a large proportion of those who responded to our surveys were autistic or representing young people who are autistic. 61% were parents of children aged 9 or under, and 11% were Aboriginal. Nearly half of respondents said they were removed from the NDIS or had their funding reduced after their reassessment. And concerningly, rates of removal and loss of funding were higher for children 9 and under, for autistic children and young people, those from diverse backgrounds, and for First Nations children. And particularly, First Nations children and young people were nearly twice as likely to have received a reassessment letter. So some of the key issues that we heard from our respondents were removal and loss of supports without clear reasons from the agency, the significant emotional toll that this experience is having on our participants and our members, a sense that this process is not fair or not reasonable, certainly an experience that the process is not clear, and unfortunately, poor treatment by NDIA staff. These are all things that we heard from our respondents. So we've formulated some suggestions for improvement, and these are some of the things that our speakers today are going to be speaking to. We're really keen to suggest clear, timely, and accessible communication from the agency to improve the clarity of the process and the expectations for those who are receiving their reassessments. We're calling for fair and more transparent assessment processes. We're calling for staff training and cultural change for NDIA staff. This is really important so that they can be equipped to work with people with disability in a respectful and informed way. Person-centred and individualised support that recognises the diverse requirements of our community and recognises that there is no one-size-fits-all approach. And broad systemic changes, such as improving coordination, stopping reassessments, and ensuring continuity of support. So we're going to move into our speaker section of the event today, and I'm really excited to introduce our speakers as they come. Overall, we're going to be hearing from Jenny Karavolos from the Australian Autism Alliance. We'll hear from Kerryann Stanley, who works with the First Peoples Disability Network. We'll hear from Bowden, who works for the Villamanta Disability Rights Legal Service, and also Liam Thatcher, who is with the Disability Advocacy Network Australia. So I'd like to invite Jenny, who is going to be speaking on the impact of reassessments on autistic children and families, for her 10-minute segment today, and really thank you for your time and contributions in this space. Thanks, Jenny. It looks like we might just be waiting on Jenny to return, but we might move on to our next speaker as I move down my list. We will be hearing from Kerryann Stanley, who is going to be talking about the impact of these reassessments on First Nations children. Thank you so much, Kerryann.
Hi, everyone. My name is Kerryann Stanley, and as Evie mentioned, I work for First People Disability Network. I'd like to begin also, like EB, with the acknowledgement of country. I'd like to pay respect. I'd like to acknowledge traditional custodians on the many lands on which we meet across the gathering today, and pay my respects to elders past, present, and emerging. I recognise the enduring connection that First Nation peoples have to the land, waters, culture, and community. This land was, is, and always will be Aboriginal land. Okay, so today we're going to focus on people with disability. They have the same rights as everyone else. But for First Nation peoples with disability, especially children, these rights must include cultural rights. Today we will explore the UN Convention on the Rights of the Person with a Disability, the cultural rights of First Nation peoples, the impact of NDIS, the eligibility, the reassessment on First Nations children, and the implications for equity, justice, and legal rights. The discussion builds on CYDA's recent report, which EB also touched on, and aims to centre lived experience and practical advocacy. The rights of people with disability, the UN Convention on the Rights of Persons with Disability, in which Australia has ratified, affirms that people with disability have the right to live free from discrimination, access education, healthcare, employment, and justice, participate in community and recreation and cultural life. Article 30 recognises the right to participate in cultural life on an equal basis. This includes the rights to language, to identity, and to traditions. For First Nation peoples, cultural rights are not separate from other rights. They are foundational and they must be adhered to. Around the cultural rights, disability in Aboriginal and Torres Strait Islander communities must be understood through a cultural lens. And I'm just going to kind of add something onto that that's not in my slide. For Aboriginal people, traditionally, we never had a word for disability. So inclusion was genetically just handled by our community and our mob. So our cultural rights of First Nation children include their connection to country, participation and kinship and community, speaking and maintaining language, sharing and learning cultural knowledge. There are no added identity healing and social and emotional. These aren't add-ons. They actually need to be in the core of the disability plans, and your right to have these cultural aspects that should be adhered to. When children are disconnected from culture, it can create deep trauma, especially when they are already navigating barriers with their disabilities. Eligibility reassessments. The NDIS have transformative for many, has been transformative for many, but was designed with a Western medical model of disability, which often doesn't reflect Indigenous ways of knowing and being and learning also. Eligibility reassessment, especially when bureaucratic or rigid, can lead to the loss of essential supports if a child is deemed no longer eligible. And I think that was also highlighted in EB's conversation early, with a lot of Aboriginal children and 11% losing their assessment, their rights to the NDIS through the reassessment. Can cause confusion or disengagement when processes feel culturally unsafe, overwhelm families, especially where there are language or literacy barriers, and severe important cultural ties. If cultural support workers or therapists are removed, this also can be really damaging to Aboriginal children and their families and communities. The impact on First Nation children. The consequences of poorly conducted reassessments are serious. Children may lose access to early intervention, allied health, or cultural specific supports. Families often lack culturally competent advocacy to challenge decisions, especially in our remote and rural areas where there's lack of services in general. Children may be funneled into mainstream services that don't reflect their needs or their identity. And this is more than a service gap. It's a violation of your cultural rights, and it fuels intergenerational trauma and systemic disadvantage. So what needs to change? We need to uphold the rights for First Nations children. Reassessments must be culturally safe, strength-based and flexible, because even though Aboriginal people have a lot in common, we also have our independent and different needs. The NDIS must embed First Nations worldviews in planning and eligibility processes. Families must be supported by First Nations-led organisations during reviews. And I'm just going to move that my way. Sorry. And cultural supports must recognise essential as an essential and not be an option. Both the Productivity Commission and the Disability Royal Commission have warned against the one-size-fits-all approaches. When it comes to First Nations children, standardised systems do more harm than good. And I think that's evidently been proven for a long time. So the key takeaways from this is disabilities rights include your cultural rights. So scream them really loudly and make sure they're heard. Eligibility reassessments, when not grounded in cultural understanding, risk violating these rights and harming the children, harming the very children in the NDIS, which they're meant to support. True inclusion doesn't just mean access to services. It means access to language, kinship, culture and country. It's your identity. We can't get this lost in these NDIS reforms as well. So let's work to ensure First Nations children with disabilities are never forced to choose between support and identity. They should coincide and be as one. For further information, I won't read these out. They'll be in the link. I'll just briefly, the UN Convention, National Agreement around closing the gap, First People Disability Network reports, Disability Royal Commission and CYDA reports on NDIS. So there's a little bit of information for you to look further. But thank you very much for your time today. And I hope that my presentation gave you a little bit of guidance on where to go to next. Thank you so much.
Thank you, Kerryann. We really appreciate you joining us today and collaborating on ensuring that what we do in our advocacy and the way that we're designing our systems are culturally safe and culturally responsive. Because your point about not needing to choose between getting support and being able to remain connected with culture, that it's not a fair choice for First Nations families to need to make. So thank you so much for your contributions.
Thank you. Thank you for the opportunity. Much appreciated.
We are going to pass over to Jenny, who is from the Australian Autism Alliance, who is going to be talking about the impact of reassessments on autistic children and families. Thanks, Jenny.
Thanks, Evie. I'd also like to begin by acknowledging the traditional owners of the land on which we join today, and I'm joining from Ganon land. I pay my respects to elders past and present and extend that respect to any First Nations people with us. I also want to acknowledge the expertise of people with lived and living experience of disability, mental health and caring. Your contribution is vital to everything that we're doing to achieve better outcomes. So I'm Jenny Karavolos. I'm the co-chair of the Australian Autism Alliance, but most importantly, I'm a parent of a gorgeous autistic young person and also identify as neurodivergent. Today, I'll be talking to you with everyone else about eligibility reassessments, but what it really means with a focus on autistic children and their families. But as you just heard from Kerryann, also all rights are applicable, of course, to all children with disability and autistic children. And of course, we understand that we need individualised solutions. But I'm not going to talk about statistics. I'm going to talk about the human impact. I do want to quickly make a comment. to acknowledge how difficult things are right now for everyone that is dealing with the scheme, with the eligibility reassessments, new planning frameworks. But I also want to acknowledge the language and narrative recently around the Thriving Kids announcement and also the paracetamol announcement by the Trump administration is not acceptable, it's disrespectful, and it's strongly condemned about the value and place in society of autistic people. So I want to speak on behalf of all my colleagues here that we're with you and we support you because we know how difficult it is. So quickly going into my presentation. So what's changing? Or what's already changed for some of you, as came out through the statistics, our families are now receiving, as you know, the eligibility reassessments from the NDIAs. So these really are, as been mentioned, letters asking families to reprove their children's disability and support needs, often within short time frames. And this poses a risk of losing or reducing supports. Now, some children entered the NDIS under the developmental delay pathway, but all are now being reassessed against the stricter test of permanent and significant impairment under the NDIS Act. And families are being asked to show their children meets the impairment categories in legislation and the permanency. But why now, you might ask? Well, the NDA has explained that this is to ensure sustainability. I'm sure you've all heard this. And to direct resources to those with permanent and significant impairment. At the same time, we all know there's major reforms underway. A new planning framework, the Thriving Kids Program initiative, government response to the Disability Royal Commission and the Disability Discrimination Act reviews happening to boot. Now, we know all of these things reshape how supports are going to be provided. But right now, families and individuals are living in the gap between the old and new systems, and children are at risk of losing crucial help before alternatives are ready. And why does this matter for autistic children? If we can move to the next slide, thanks. Is that we know autism doesn't fit neatly into those boxes. We know that for all disability, no one fits into neat boxes, but particularly for autism, we also have these impairment categories. We know that many children have co-occurring conditions, say ADHD, fluctuating function, or they mask difficulties at school or other environments. So functional needs can be hidden or vary day to day. I don't think I'm telling you anything new, but supports like therapy, trained support workers and specialist equipment are definitely not luxuries. They're scaffolding that allows children, young people, to develop communication, social and self-regulation skills and participate at school and in the community. So when those supports are questioned and interrupted, the effects are immediate and profound, and children can feel like they're on trial, as do the parents, and having to repeatedly provide or prove that they're on a lifelong disability. It is stressful, it's expensive, and it can undo years of progress. Again, we're trying to work out where does autism fit in this reformed world that still hasn't landed. And as we all know, if the world was just built for us and our loved ones. So what we don't want to see, because I was asked to highlight implications, is for our children. So if we move to the next slide, thanks. Is that therapy stops and trained workers leave. We do not want to see skills regression, social isolation, routines breaking down, missed school, community participation, or any kind of long-term developmental impacts. And for families, on the next slide, what we don't want to see is anxiety, burnout, that feeling of constantly defending your loved one, the inequity that we've just heard about First Nations, but also culturally diverse families, rural families. And we certainly don't want to see any informal carers not being able to preserve the life that they've got and being forced out of the workforce due to increased demands. I'm telling you this in terms of what needs to change. So the Australian Autism Alliance, CYDA, all the other DROs, other DRCOs, peak bodies effectively are calling for systemic change. And what we need is to recognise that autism is lifelong, to focus on the evolving needs and not diagnostic labels, give families the clear communication that's been called for, making sure we guarantee that there's no child removed, so the no gap guarantee until these programs and supports, and that they're adequate, they're affordable, they're available, they're accessible, making sure it's co-designed, and we need to make sure that the staff involved, government staff, including NDIA, are actually trained in both all disabilities, but including autism, trauma-informed practice and cultural safety that Kerryann referred to. So given that's not going to happen overnight, what we're putting to you is how can families, what can they do right now to prepare themselves? And you'll hear more from the next presenter. But a high level, while we're pushing for systemic change, there are practical steps families can actually take. So one is to keep records that's up-to-date diagnostic and functional reports ready at hand, get therapy notes from therapists, school reports, and keep a notebook about daily impacts. I won't go through everything because I do know you're getting access to this information later on. So I packed more in to make sure you could take it away and keep it as a checklist. But you want to watch the timelines because the 90-day deadlines. You want to make sure you use your right to communicate with the NDI delegate. You want to seek advocacy support early. You can link in with other supports, including local area coordinators, childhood partners, foundational supports, the local school networks. Connect with us, connect with other DROs and DRCOs, and you need to connect with peers and make sure, of all things, you are looking after yourself. We are definitely here to work with you, but a few key takeaways right now are eligibility reassessments can be daunting. We understand that. With some good preparation and clear evidence of functional needs, you've got the best chance to secure the supports that you yourself or your child needs. And if the decision feels wrong, you have the right to challenge it, and you'll hear more from Lois. Keep in contact with your disability representative organisations, autism peak bodies, and independent advocacy groups, because we're all here to support you. I'm going to keep pushing for that systemic change so that you don't need to do that heavy lifting. So in closing, our children and young people definitely deserve continuity, respect and stability while reforms are rolled out. With that proper planning and co-design, we can make reassessments fair, more trauma-informed and supportive rather than harmful. And you'll see in the next slide, there's some further information. So again, I know you'll be receiving this information of areas that you might find helpful. So I just want to thank you for the chance to speak with you today and keep in touch. Thanks.
Thank you so much, Jenny. It's really clear that there are impacts across our disability community right now. And certainly as an autistic person myself, I hear your point and really feel like particularly the autistic community is having things coming at us from all directions right now. So for those autistic folk on the call today, for those listening to the recording, and for those who love and support us, stay together. We keep collaborating, we keep working, and folk like Jenny and my team at CYDA, we're working really, really hard to make sure that our voices are heard alongside all other children and young people with disability who really need responsive and effective supports. We are going to turn next to Lewis, who is a casework lawyer at the Villamanta Disability Rights Legal Service, who is very much our legal eagle today. And he is going to be taking us through NDIS and Your Rights, your legal options, reviews, and appeals processes. Thank you so much for joining us today.
Thank you very much, Evie, and thank you, Jenny, for giving me a perfect lead-in into what I'm about to talk about. My name is Louis Bowden. As Evie mentioned, I'm a lawyer from Villamanta Disability Rights Legal Service. Like the others, I'd just like to start with an acknowledgement of country. So we acknowledge the traditional custodians of the land. Where I am is the Wadawurrung people of the Kulin Nation. I live in Ocean Grove and my office is here in Geelong. We pay our respects to elders past, present and emerging and acknowledge all people with disabilities. Continue to lead and inspire our work. So I'm going to talk about essentially the major steps that are involved in a eligibility reassessment. So from the triggers to what triggers the NDIS to make a decision to reassess someone's eligibility, to the letter that you receive, to the review rights, and then all the way up to the ART. So I'm not going to go too much into the Administrative Review Tribunal, which is the independent body you can review NDIA decisions to, but I'll get up to that point. So we'll just go on to, we'll go on to the next slide if we can, sorry. So I'd just like to start with the main sort of steps, I guess, in the reassessment process. The main ones that we sort of look at are, the first step is the decision by the NDIS to review someone's plan. So you find out about this through a eligibility reassessment letter that you might receive from the NDIS, but it kind of happens prior to this. There is a trigger process, but we'll get to that in the next slide. The next step after that is the NDIS's decision. So important things to kind of take away from this is that that decision should let you know if the decision is to remove access, is to revoke eligibility to the NDIS. You should find out when that actually happens, the date on which funding is no longer available to use. That's important because that funding can effectively be used to gather evidence and to go out and try and get assessments and reports from medical professionals that may help with the reassessment process. So it's very important to keep that date in mind. It then gets to the internal review decision, which is an NDIS internal review. And then after that, the external review to the Administrative Review Tribunal. So we'll go through all these steps through the next 10 minutes. So key takeaways here. So as has been common through the past couple of presenters, and it's just a good rule in life, try not to panic. The next step is we recommend to people that we give advice to and a lot of people that we speak to, it's important not to jump out and try and get as much evidence as you possibly can too early without knowing what questions need to be answered with that evidence. So we do recommend kind of taking your time to find out information, as much information from the NDI as you possibly can about what evidence is required or what the gaps in the evidence or what questions the NDIS have about the eligibility of the participant that need to be addressed. Don't rely on the NDIA call centre. They're good to ask a few little questions, but they're not going to take notes and they're not going to keep records of your calls. So make sure that you do take notes and you do keep records just to make sure that you're documenting the processes. The very last thing, we have a template at Villamanta about eligibility reassessments. We have the template includes information and it also includes what you can put in a letter to the NDIA should you receive an eligibility reassessment letter. So don't panic. We do have a template. If you do need advice or you do need support, should you receive an eligibility reassessment letter, give us a call and we can help you with that template letter. So what do you do if you get an eligibility letter? As has been mentioned a few times, timeframes are very, very important. So check the timeframe. As Evie said at the beginning, right at the top, it was extended to 90 days back at the beginning of this year, going up from what was 28 days prior to that. However, we actually have seen shorter dates. We've just seen sort of arbitrary dates in these letters. So it's very, very important to check and not just assume the 90 days is going to be applied. If it isn't 90 days, then that's reason to sort of say to the NDIA, hang on a sec, I thought this was supposed to be 90 days and ask for an extension of that time limit. We'll go on to the next slide, please. So we recommend getting in touch as soon as you get a letter from the NDIA. We recommend getting in touch with the NDIA to seek more information about what evidence they are requesting. You get a fairly generic letter in the eligibility reassessment that just has the broad legislative criteria for the NDIA access rather than specifics about your individual case. So we do recommend getting in touch with them straight away. As suggested, we do have a template that can help you kind of formulate this letter if you do need help. In terms of reaching out and seeking assistance from professionals, whether they be lawyers like myself or advocates or just someone who has a little bit more experience in this space, this is a really good place to do it. This is the first time to reach out for help when you first get this letter, even if it's just advice on what to do next. So what to include in your letters to the NDIS? So basically you're looking for information. You know, why has eligibility been reassessed? I talked about triggers a little bit earlier. So essentially there is NDIS's internal guidelines. So they're internal kind of processes that, or their internal policies that guide their processes. There has to be a reason for them to reassess your eligibility. So basically they have to come across new information that gives them a reason to reassess your eligibility. How that works on a practical level is difficult to say because we don't work internally at the NDIA. However, according to their own internal guidelines, that is one of the triggers. There must be a new piece of information that's been provided to them that triggers this. Also, in relation to the sort of things that must be done before an eligibility reassessment, they also are required under the same internal guidelines to do what is a procedural fairness checklist. So it's essentially like a risk assessment that they're required to do. So that's just something to keep in mind when you are having these conversations with the NDIS, to ask them about these questions. So along with why eligibility is being reassessed, obviously you want to know information about what evidence the NDIS would require in order to reassess the reassessment. And the very last thing is any specific questions to medical professionals or individuals that may be able to give evidence to meet these gaps. So as suggested before, there is a reason why this reassessment process has been triggered. So there must be some questions the NDIS have to ask. You know, that previously there was access, now there is not access. What questions have been raised that need answering? So as I mentioned before, confirm the 90-day timeframe, or you can ask for an extension if there is, the 90 days is not going to be enough. There is provision in the NDIA Act to extend that timeframe. And there's a range of reasons why that can be. So we all know that it can be difficult to get appointments, and it can take a long time to get assessments done and then reports to be completed after the assessments. So this is a reason to request an extension should you be actively targeting a specific piece of evidence. The last thing you should include in your letter is the risks to the participant. So what may happen if supports are removed, which is a very important consideration for both the NDIA and if it gets a little bit further to the tribunal. Next slide, please. All right, so if you don't hear back from the NDIA, follow them up, try and get a response. If you don't get a response from them, which does happen, do your best to provide whatever information you can within the 90-day period. So the next thing that happens after that, if they do decide to remove your NDIS funding, you normally have 28 days from the date of this decision before your plan is ended. It doesn't seem like a long time, and it's not a long time, but these 28 days, if this decision is made, are the last chance you may have to use the funds in your plan to go out and get some reports and assessments. So it is another time to kind of go, okay, cool, I have to take action and get involved. This is also a fairly risky part of the process because it's around about now that supports get removed, but you're not at the external review process yet. So there's a little bit of a risky period here. If supports are completely removed, in order to have those supports reinstated, there is always going to be a gap between now and then. So next slide, please. All right, so as soon as you get the decision that eligibility has been revoked, make an internal review request to the NDIA. So this is the NDIA's own internal review decision, internal review process. In my experience of working in this field for a number of years, I haven't seen the NDIS make a different decision on an internal review that they made originally. However, I'd be happy to be corrected on that. However, you need to go through this process and you need to follow the steps. So there's something called a deemed decision in relation to timeframes with decision making. So in relation to an internal review request, you have 90 days to make that request after you receive the letter. But after you've made that request, the NDIA have to respond within 90 days. So if they don't respond within 90 days, it's considered a deemed decision, which means the initial decision is upheld. So at that point, after the expiry of 90 days, is when it opens up the door to the next step, which is the external review. So one tip that we recommend is asking for an urgent internal review to try and get it done quickly. NDIS make a sort of bold statement that they try and get these done within 60 minutes. 60 minutes, 60 days. So we do recommend following up with them after 60 days if you haven't had anything. All right, so now we're getting to the heavy stuff. It's all heavy up to here, but now we get to the tribunal. So this is the Administrative Review Tribunal. So after you receive the internal review request decision, or after the expiry of 90 days with no decision from the NDIS, you're able to apply to the Administrative Review Tribunal, which is an independent federal body that makes independent decisions, to review the decision by the NDIS. You have 28 days after receiving the internal review decision to make this request. The ART, there is a mechanism to extend or make an out-of-time application if there are reasons why you haven't been able to make the application within that 28-day time frame. And the ART are usually quite understanding of this if there's legitimate concerns and legitimate reasons why. But try and do it within the 28 days to avoid all the nonsense. The next thing I'm going to talk about is what is known as a stay application. So I mentioned before that there is a danger period where supports have been removed, but there's no way of having supports being reinstated for a period. A stay application is a mechanism through the ART where the original decision can be put on hold while the review is happening at the external tribunal. So the effect of this, if it is successful in the case of an NDIS revocation, is that the most recent plan will be reinstated if the stay application is successful. The most recent plan will be reinstated for the period during which the matter is before the tribunal. So what that means is that the person who needs supports in order to, live their best life is able to have those supports while the matter is before the tribunal and hopefully be successful in their external appeal, and then that just continues on. There is a big risk with this in that if a stay is granted and those supports are reinstated, but the actual review itself is not successful at the end of the day, there is the potential for the NDIS to try and recover that money. And knowing the NDIS, they will. So it's a risk. There's always a risk with taking, with these sort of things, but that is just something to keep in mind when making a stay application.
Just a couple of minutes left, Louis.
I'm nearly there.
Awesome.
Sorry. So there's the example wording. I won't go through it because you will get the slides at the end of it. And I will remind everyone here that we'll give Villamanta a call. We service the entirety of Victoria, but we can most likely provide you with the template depending on, regardless of where you are, for the letter. We'll go to the next slide, please. Right, so what is considered by the actual tribunal in relation to the stay application is listed here. So this comes from pretty well-established case law from not an NDIS space, but ASIC. But it was applied in an NDIS matter that I ran not long ago. And so we're fairly certain that this is how the tribunal will, these are the elements. So whether you're likely to succeed in your main review is the main consideration. And that's something that you should consider yourself when you're weighing up the risk to accruing a debt with the NDIA. Consequences to you, so that's risks to the participant, which is very, very important. And then the rest are there, which are basically kind of procedural things like whether it's in the public interest to grant this stay, whether or not it would put the respondent at a disadvantage throughout the ART process, which is an argument that can be made. The rest of them are there. So we'll just move on to the last slide and then I'll let you all go. All right, so after all of this, you've done your stay application and it's been successful and your supports are reinstated. Now you're before the ART, you're before the Administrative Review Tribunal. If you have made a stay application that has been successful, there's a high likelihood that directions will be put in place in order to set pretty hard dates to get the matter, to try and progress the matter as quickly as possible. So for a number of reasons, so the ART can resolve it, also so the NDIA are not liable to pay for the supports for ongoing time. They try and wrap it up within 6 to 9 months with a stay application. So at this stage, it is alternative dispute resolution, which is the first part of the ART process. That is basically a facilitated discussion with the NDIA to try and resolve the matter. So it is not a member making a formal decision. At the very first start of the process, it's mediation. It'll only get to a member once, every sort of opportunity to resolve the matter outside of a hearing has been taken. Couple other things that I'll just touch on, and then I'll get off. The very first thing is that there is very likely to be further evidence that is requested, and very likely to be further evidence that is needed to be submitted to the tribunal in order to have a chance of success in your matter. So the NDIA will often make suggestions as to what evidence they require. One of these is a independent functional capacity assessment. So that's usually an OT or a neuropsych doing a functional capacity assessment. A completely independent person, one that has no experience with the participant before, which comes with its own challenges. The other thing is targeted questions for medical practitioners. So that's, as I mentioned, 4 specific questions. Last thing I would like to say is that the case conferencing process, you get a big block of documents that's called the T documents, the tribunal documents, that has everything that the NDIS have considered in order to make their decision. It's not necessarily everything that exists on file at the NDIS, but everything that they've used in order to make this particular decision. Within that bundle of documents, there will often be 2 things that are really just interesting to find and look at, particularly in relation to reassessments. The trigger of why the reassessment process was started in the first place will likely be included, as will the advice that the NDIS decision makers relied upon. So the sort of technical advice to make their decisions. So these are just interesting insights into why the NDIS have made their decision that you may not find out until this point. I'll leave it there. Thank you very, very much for having me, and it's wonderful to talk to you all. Give Villamanta a call. The 2 points are when you receive the letter, and then when you make an application to the ART. They're the 2 most important points for us to get involved, or someone to get involved to provide advice.
Thank you so much, Louis. And what you've done there is laid out a very clear roadmap about the steps that you might need to take when a reassessment letter arrives with you, and also the ways that you can reach out for support and the different points where you can. And I think the real takeaway from all of that for me is don't just accept the letter and ask no questions. Try to engage with that process as much as you can to squeeze out the information that you need to be able to best advocate for yourself or for your young person. And there are folk around who can help you navigate that process, like Villamanta. So thank you so much for giving a really, really clear and practical guide for people navigating this process, because certainly trying to collect all of that information ourselves is really, really challenging. It's great to have really smart, intelligent folk like you and your team doing that alongside us. I just want to remind folks that as we are in a webinar format, we won't be having audience or participation in this session today. So we won't be doing a Q&A session, but I do encourage you to flag any questions or feedback that you have in the survey that we will give you after the event is complete, so that we can continue this conversation and make sure that our advocacy is reflecting your priorities. And a reminder, you will get a recording and the slides from this session as well. I'm now going to hand over to our last speaker, who is Liam Thatcher from the Disability Advocacy Network Australia, who is going to talk about what's next for the NDIS. Take it away, Liam.
Thanks, Ebe. Hi, everybody. As Ebe said, my name's Liam. I'm part of the policy team at Disability Advocacy Network Australia. We're the peak body for about 80 orgs across the country that all step in to assist in situations like these where systems aren't working, things are breaking down, and people need a bit of assistance to get a bit of to navigate some really tough political, legal hurdles that come up along the way. I'll quickly acknowledge I'm joining you from Ghana land, and also want to acknowledge that this land was never ceded, and pay my respect to First Nations and Elders folk from all across the country that are joining us today. My quick chat is going to be a little bit more targeted towards stats, seeing how things are at the moment, and then casting a glance a little bit further towards what might be coming next. And I'll put a bit of a hat on some of the discussions that have been taking place around thriving kids. There's a big discussion there, but there are a particular couple of insights I might think be good for people to know as we head forward from here. It's been said before, this process of eligibility reassessments coming to the fore a lot more is something that the NDIA have insisted is sort of picking up lost work that wasn't done during the COVID period, where there were lots of focus on making sure people were safe and being cared for and had the supports they need in a very, very tough environment. As the CYDA survey said, and as some stats came out in estimates, I think late last year, it is children and young people primarily that are being targeted in these processes. The split is about 90% children and 10% adults. One of the first changes that came back from the NDIA in response to this feedback was giving people 90 days to provide information in response to an eligibility notice instead of the default 28 days, which has certainly been an improvement just in the practical sense of getting reports together. But as Louis noted, that can still take its own time and definitely encourage people to go through the process of asking for extensions as necessary. But one of the things that has come through the process is that 90-day period sort of started in the early part of this year, and a lot of those 90-day periods have started to come to a close through July, August, September. And that's sort of one of the reasons that statistics-wise at the moment, one of the things we've been hearing from the NDIA and others is that they're not seeing a great many cases go to the tribunal as yet. Lots of different reasons for that. Simply internal reviews and some of those processes that Louis talked about can take a long time. People may not be aware that they do in fact have rights about internal review and the tribunal. That was certainly a big complaint we had in some of those initial notices that went out to folks. As we noted, reports can take a long time to gather, and indeed the NDIA themselves, frequently miss their internal review times. So we're expecting, and I think the collective sense within a lot of folk is that this is probably an issue to stay, and we're going to see some of those elements come through in internal reviews and external reviews probably in the not too distant future. So lots to keep on top of as we go forward. All of the issues, all of the recommendations that came out of the CYDA report are ones that need to be front in mind when we're talking about these sort of changes. We're talking about a procedural fairness, making sure that you're only getting these notices if there is a legitimate question about eligibility, that the NDIA isn't just fishing for people that they might want to cast off the scheme. A lot more information needed about the types of information that are going to be beneficial. And indeed, making sure that those internal review processes happen quickly, particularly in an environment where you're without supports and you need those things to be back in place as soon as possible. I'll go on to the next slide, which talks about thriving kids, which happened in the time between us having a chat about this presentation and ultimately having the session today. I probably don't need to go over a ton of extra detail. I imagine most folks on this call are reasonably well across it, but Minister Butler at the Press Club late August announced that Thriving Kids would be a new program in place. It's the form of targeted foundational supports that was talked about in the NDIS review, aiming to reduce the growth of NDIS, to have services that exist outside the NDIS, and indeed make sure or shift some services that people are getting in the NDIS now to systems at a state level, whether it's hospital, whether it's community, whether it's something else. I thought Jenny put it really well, some of the troubling remarks that flowed on, particularly as it relates to autism in the middle of all that, and want to offer my solidarity on those points as well. There was lots of really concerning talk in that about evidence, permanence, and costs and burdens, which I know is some incredibly difficult talk for people to wade through with everything else that's happening here. There is an opportunity for tailored supports if it's done right, but one of the key things to take away from the announcement was that there wasn't actually necessarily a ton of detail about where those supports might be, where they'll be at a local level, and indeed the state and territory governments, as far as we know, haven't signed on to a committed plan about how this is going to look and what this will mean in sort of practical details. If I go on to the next slide, one of the things in many things that were said in that presentation was that there may be changes to the actual access criteria as a result of the Thriving Kids program. It could be features like age. It could screen people, say, under 9 from the scheme. It could further narrow that down under some sort of assessed level of impairment or disability type. This is all speculation on my part. This is not stuff that we know for sure as yet, but the spectre has sort of been raised and is going to be a big part of the discussions that we have going forward. One of the things that we're keen to stress in the middle of all that is that people in the scheme currently will sort of be grandfathered in. Those people already in there will be able to stay in the scheme and continue to receive those services as necessary, subject to a lot of the eligibility reassessment processes that we already talked about today. And as we know from CYDA's studies, from the discussions that we've all had, from the collective sense in the community, that can still be a really large point of friction for lots of folks. And one of the things that's really urgent at the moment is that there's a lot of talk about putting people onto state or local systems, putting them onto foundational supports that, of course, don't actually exist yet, that are all consolidated around the NDIS and indeed don't have a clear pathway to getting those things through anything else other than the NDIS. So all of that design is going to be incredibly important. If you have a time, one call to action, I think, in the short term to contribute to systemic stuff going on in this space at the moment is to fill out the survey link. Maddie's just dropped it in the chat, which is absolutely fantastic. The federal government is in committee. They're going to be doing a review of some of the Thriving Kids proposals. You can do a submission yourself, but maybe one easy way is to fill out the survey that's on the link there to raise your concerns, to talk about what the process is like now, indeed, and some of the things that we need to fix going forward. It'll be a really tumultuous time, I fear, with all the changes that are taking place at the moment. But as Louis very well described, there are services like Villamanta, legal aid bodies, advocacy services all across the country that are staffed up to assist. We may not be able to be along every side of the journey. Sometimes might have to be one phase here and another there, but there are people who hopefully help support you regardless of where you're at, and want to reinforce that sense of community that Jenny and Eve talked about earlier. We want to make sure that these systems are right in place. That work is certainly not done, but there is more that we can always be doing going forward. Thanks, Eve.
Thank you so much, Liam, and I really appreciate your overview of how all of these different systems and changes are connecting together. Because as we've mentioned today, there's a lot going on at the same time. We're being pulled in a lot of different directions, but I hope that everyone on the call today can feel confident in the fact that there are lots of organisations and lots of people working at various different levels of the system to make sure that we can get good outcomes for children and young people with disability and people with disability in general. Today, we heard from Kerryann the very specific impacts and experiences of First Nations children with disability, and a really strong call to action around the importance of ensuring that these services are culturally safe, trauma-informed, and that we get really strong cultural competence built into the NDIA. We heard from Jenny around the experiences, particularly of autistic children and young people, and the way that this reassessment process is particularly impacting this community. We heard from Louis around some of the very practical tools and roadmaps that you can use in navigating this process. And I really encourage you to use those slides and use that guidance in scaffolding your approach, because you are not by yourself here. And Liam has brought us home in looking at some of these bigger systemic and policy drivers and some of the really big changes that we are really pushing for, as a collective and as individual organisations as well. I really encourage you to complete the survey to give your feedback on the webinar, and also to communicate your continuing experiences and where you would like CYDA to be going. We take that really seriously, and our advocacy is led by our members. We really want to make sure that what we are doing is helping you and responding to the experiences that you are having. And a reminder that you can also reach out to a range of the support services that we have linked in the chat, and that you can see on the slides as well. We also have our safety and wellbeing officer, Liz, who is on the end of a mobile phone line if you need support after the webinar. But as you move on into the evening, I really want you to feel like there is a big ecosystem of people who are alongside you, who are navigating this with you. We've had over 100 participants in the room today, many of whom are people experiencing potentially something similar to you, and or who are working in this space to make it better for everybody. So I want to thank you for your time and your generosity and commitment to children and young people with disability. And I hope that you have a restful evening. Thank you for joining us.